Okay, now we are going to finish the anterior portion of the pulmonary examination. And first, I would be inspecting. I'm looking at his facial expression. I'm looking for any pursed lips breathing. I'm looking for any nasal flaring. I'm listening for any audible wheezes or sounds or stridor. I'm looking at the anterior chest and posterior chest from the anterior posterior diameter from the anterior view. I'm looking for any barrel chest. I'm also looking for any use of accessory muscles. I am looking if there's any pectus excavatum or pectus, let's see, if it caves, if the chest caves in or if it protrudes. I'm looking for kyphosis, and I'm looking at chest symmetry and expansion. And now I'm going to palpate the chest area, and I am palpating for any crepitus, if I feel any popping sounds. And then I will go ahead and do the auscultation portion of the examination of the thorax. So I'm going to listen to the rate and the rhythm of the breath sounds. I'll start in the tracheal area. And I'm listening for the breath sounds, the vesicular, the bronchovesicular. And I'm noting the rate and the rhythm. I'm listening for any adventitious breath sounds as I was doing that. And that will complete the entire thorax and the lung examination. Now I will move on to the abdominal examination. For the abdomen examination, I'm looking for symmetry. I'm looking for any striae. I'm looking at the color, which I noticed some redness, looks like some sunburn here. And I'm also looking at the contour of the abdominal area. I'm looking for if it's protuberant or if it's concave or scaphoid. I'm looking at any rashes or lesions or any dilated veins. Looking at the umbilicus, if there's any bulging. I am looking at the peristalsis waves for any aortic pulsations. I do notice some aortic pulsations in this area. I'm not seeing any really peristalsis waves. But then I'm going to do the auscultation portion of the exam, because we want to auscultate before we percuss or palpate. And I'll start in a clockwise motion, starting with the right lower quadrant. And there I was listening for any gurgling. I was listening for the abdominal, any peristalsis. I was listening for the abdominal sounds. And I auscultated all 4 quadrants. And now I will be percussing. We've already done the aortic, the renal, the iliac, and femoral. We already listened to those in the previous exam, but I can go ahead and do that again. I'll listen with the diaphragm. Start with the aortic and move on to the renal. I'm listening for any bruise. Listening at the iliac, and then the femoral would be here and here. And I'm listening for any turbulent blood flow. And now I'm going to start with the percussion, and I'm going to listen. I'm wanting to hear tympanic percussions in all 4 quadrants. I'll start with the left lower quadrant, or the right lower quadrant. And start here. And I'm listening for that high-pitched tympanic sound. And then we will move on to the palpation portion of the examination. So I'm going to start with light palpation, and I'm going to be pressing in on your stomach. And I will be doing the light palpation, which is 1 to 2 centimeters, and I'm just feeling for any, seeing if the patient has any reaction to my touch, if there is any tenderness or any guarding, and I was also feeling for superficial masses, if I felt any masses in his abdominal area. And then I'm going to move on to the deep palpation, which is going to be about 3 centimeters deep. And first we will start with rebound tenderness. So I started in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and just seeing if the patient had any tenderness whenever I released those areas. Then we are going to palpate the liver. So on the right side, I am going to, around the mid-clavicular line, okay, I hear a resonant sound, and I'm going to palpate until I hear a dull sound. I heard a dull sound right here. And then I'm going to, and then I need to mark this area. And then I'm going to go back and listen to my tympanic sounds. Okay, and about right here is where I heard the dull sound, went from tympanic to dullness. So I'm going to measure from here to here. Place your finger. Oops. No. Did it stop? No. Okay. So place your finger right here. And I'm going to get a measuring device. And I'm just going to measure from there. Okay, that's good. And this is about 6.5 centimeters. And you want that to be 6 to 12 centimeters, so that is normal. And now we are going to do some deep palpation. We are going to feel the liver. We're going to have the patient inhale and then exhale. And we will be noting the liver edge. You should be able to feel the liver edge. And then we will palpate on this other side. We're going to palpate for any splenomegaly, see if the spleen is enlarged. Here this is where the sigmoid colon would be, and over here would be the appendix. And up here would be for any liver enlargement or gallbladder tenderness. So let's see. Now we will do some special examinations. Let's do the cholecystitis. So that would be the gallbladder, and we will do that examination. We will do cholecystitis. So we are going to do the Murphy sign. So in the right upper quadrant, we would press in and feel here, and we're going to ask the patient to take a deep breath. And he didn't catch his breath on that inhale, so that means that there was no sharp pain, so he didn't stop with the inhale of taking the deep breath. So that's a good sign. That means it's negative for Murphy's sign. McBurney sign, we're going to do the right lower quadrant, and I would press in, and if there was any pain with that, and he didn't seem like he was in any pain when I did that exam. The psoas examination, this is going to be for the appendix as well. So I'm just going to have the patient flex their thigh, and I'm going to have the patient flex his hip and his thigh and see if there's any pain in this area. Any pain, tenderness. Doesn't seem like there's any pain. And that was the psoas. And then the obturator examination. So I'm going to have him flex his knee, and then I'm going to do internal and external rotation and see if there is any tenderness whenever he did that. And that did not cause any pain. And that checked the appendix because we had the patient flex his knee at 90 degrees. And that will complete the abdominal portion of the physical exam.